purpose of this assignment is to begin to use our critical thinking skills as we evaluate the validity and importance of different studies and publications. So the article that our group evaluated for this project was based around the hypothesis that periodontal disease causes adverse pregnancy outcomes. Throughout the article, they referenced various studies that all stated that low birth weight and other adverse pregnancy outcomes and periodontal disease sometimes occur in the same patient, but that there is no way to accurately infer that these adverse pregnancy outcomes are caused by periodontal disease. As we discuss this article, we will go into more detail about the difficulty of studying pregnant women and trying to prove causation. So now we're going to have Josh start us off by explaining PICO and how it relates to the article we used.
PICO. It's a support-based evidence tool, right? It's broken down into 4 parts. You got P for your problem or population, you have I for intervention, you have C for comparison, and you have O for the outcome of your whole evidence. So anyway, according to this article in dealing with pregnancy and adverse pregnant outcomes, our population is going to be pregnant women because obviously the intervention was we're trying to prevent adverse outcomes on the pregnancy due to perio-related or oral cavity problems, whatever's going on. We don't want it to pass on through the placenta and go to the child that's in the womb. At least that's what the article's talking about. For comparison's sake, there's not a huge amount of stuff to compare it to because there's not a lot of stuff they can do because they don't want to do anything invasive because they're pregnant and they faced a lot of ethical dilemmas, as we could say. I mean, I kind of have a couple of pages on it, but it's neither here nor there. So they chose to do some meta-analysis, and so that's what they're comparing their meta-analysis results to other meta-analysis results of treating them with NSPT, non-surgical periodontal therapy, for those that don't know, and trying to take care of it on the patient before she gives birth or while she's in her, like, usually before they're supposed to be pregnant, but again, it's very limited.
So what you're saying is you're trying to compare when treatment should be done?
Yeah.
Those are your different comparisons.
Yeah.
Okay. And then the outcome that you desire?
The outcome that we desire is no adverse effects on their birth, or at least a reduced adverse
Yeah, I would say
outcome.
reduce it.
And I would say the intervention is what they're implementing as the intervention is the non-surgical, the periodontal therapy.
Agreed.
Which you
Because
have to do at
they are
different times.
saying that if you get that, then it will lower the adverse.
Yeah, that's what
That's
they're
trying
trying
That's
to
what
prove.
they're trying to
Yeah.
do.
Yeah, so the intervention would be the non-surgical periodontal therapy.
Right. In comparison, would either be not doing the treatment
Mhm.
or a different variation of the treatment,
Essentially.
essentially. So, thank you. Now we're going to head it over to Kat to talk about search criteria.
Thank you, Kristen. There were several different search criteria used to try and establish a correlation between periodontal disease in pregnant women and adverse pregnancy outcomes. First, researchers used epidemiology studies, animal models, and in vitro models to investigate adverse pregnancy outcomes, or APO. That means that the search criteria is based on finding studies about adverse pregnancy outcomes and periodontal disease to analyze as new studies were not completed.
Yeah, and it's also important to note just because the association between periodontal disease and preeclampsia, it does not mean that the periodontal disease causes it. There's a association, but there's no causation. And there was also not mentioned whether the periodontal disease in these studies was periodontitis or gingivitis, so we really just don't have all the necessary components to see everything as a whole picture.
Yeah, that's true. Exactly, Karen. It is also interesting that they have to exclude any testing on pregnant women. Of course, not including tests on pregnant women is justified, but without studies that can directly measure periodontal disease in pregnant women and the adverse effects that are directly related to specific periodontal pathogens, our conclusions of these studies will always be limited to possible correlations with no proof of cause.
Yeah, and due to the ethical dilemma of performing studies on pregnant women, we're currently locked into these types of studies, mainly because we have to consider if it's ethical to perform these type of tests on fetuses that cannot knowingly consent.
Yes, that is true. We have to consider both the pregnant mother and the unborn child in these types of studies. I think that is why they performed meta-analysis on multiple studies, because they had to use information
I think it was like 10,100
Like cases involved.
Yeah, people.
Yeah, and the article mentions several different groups of studies, but it does not always specify what type of study or how many. Also, even with multiple studies, there seems to be several inconsistencies amongst the results of the studies.
Yep.
There is.
And it doesn't help that the studies have to be performed on rats.
Right.
Which is
Rats.
crazy. I know.
And we're not rats.
Yeah, we're not rats. That's a big difference. That has to do a lot with the ethics of studying on pregnant women.
Pregnant rats is cool.
Sure.
Yeah.
But that's still a little bit more complicated since rats and humans don't share the same oral microbiome. So.
That's true.
Okay.
Boy, howdy.
You're damn
Sorry.
right. That's great.
Okay. What a lively discussion. Everybody has made some great points. But I also want to give Karen a moment to discuss
The research.
the
I
research
got you.
design.
Uh-huh,
Thank you.
Thank you, Kristen. I got it.
Okay.
So qualitative design is a small sample size that allows for a more in-depth explanation or explanation with interviews, stories,
Better quality.
perspectives. Not necessarily better quality. They're just two different viewpoints when you're thinking about qualitative and quantitative. Because qualitative, you're really doing more of those, why is this happening? You can get more in depth with the subjects or what's happening, versus a quantitative using a large number, so using surveys that aren't, so you're not meeting with them one-on-one, so you don't get that face-to-face interaction, or you're not getting their stories or their perspectives on something. But you're getting a lot of data, which in order to get like drugs approved or vaccines approved, you have to get a lot of data. So it's important that you have both. And then you can also do a mixed, which combines both of them. And so you could go ahead and do, to get the quantity, you hand out a survey, and then you could do focus groups, which will allow you to narrow in and get those perspectives. And then for our study, the article was a meta-analysis of multiple studies, and it focused more on trying to create a quantitative data, specifically for many women who have adverse pregnancy outcomes that have periodontal disease.
Thank you, Karen. You explained that really well. Now I want Ruben to talk about the level of evidence in regard to our article.
Yeah, so I think we all read the article. It made it very clear that it was a meta-analysis.
Outdated.
It did.
Yeah, outdated
It was
too.
outdated, yeah, it was 2019 our article.
2018,
Yeah.
So because it is a medical meta-analysis, and they mentioned it throughout the whole article, this is going to be considered a level 1. This is a
Makes
meta-analysis.
sense.
However, it does include testing on rats, which is non-humans. So that would also be considered a level 5. However, the entire article is a meta-analysis, so we're going to keep it at level 1. And it is also difficult to prove the cause between the periodontal disease and the APO. And the studies involved in the meta-analysis in this article lack the statistical significance because they all failed to prove any sort of correlation or causes.
Yeah, and I think you're right, Ruben. The studies have tried to prove causation, but even with some correlation between periodontal disease and adverse pregnancy outcomes, there's no clear evidence between these two factors. The same periodontal bacteria appear in the placenta and the umbilical cord of both women with and without adverse pregnancy outcomes. So to prove true correlation between periodontal disease and these outcomes, we need further studies to be completed. But the main point of this article was that more research is required to establish any true connection. In regard to the credibility of the publication, it's credible in the sense that it references studies accurately, be that as it may. It's technically outdated and does not provide statistical significance, like you said. When it comes to how I would utilize this information in the article in the practice of dental hygiene, I would note that the article does emphasize that performing periodontal therapy while a pregnant patient is pregnant
Yeah.
does not change adverse pregnancy outcomes such as preterm birth or low birth rate. So I'm really not gonna stress performing periodontal therapy on a pregnant patient if there's more important concerns about the pregnancy that are gonna outweigh periodontal concerns. I just wanna focus on making sure we emphasize proper home care with that patient before, during, after pregnancy.
Yeah, I think that's more important than trying to focus on the adverse pregnancy outcomes. You want to make sure the patient is stable.
Right.
And then also doing, once they have their child, what are they going to do? Like, when do you bring your child in? What should you look for and stuff like that?
Oh, yeah.
What a tongue tie could affect. So I think that's more.
Patient education is really important with every patient, but pregnant patients specifically.
Yeah.
Does anybody else have any more comments, anything to say?
So pretty much it's just up to the immune host response for everything.
It's multifactorial.
Multifactorial at all times because everybody has periodontal pathogens.
Now, whether your immune system allows that to develop into gingivitis or periodontitis, there's a lot of different things that can happen.
And it's hard to blame it on only pregnancy.
Yeah.
That's on record.
We're recording, guys.
Yeah. Throughout the article, they referenced various studies that all stated that low birth rate and other adverse pregnancy outcomes.
How about we?
That's a big word for Boy, howdy. Sorry. Start us off by explaining PICO and how it relates to the article
Like 10 minutes.
Is that okay?
Orientation.
Yeah. Yeah.
Okay. Okay, we're done.